Hello, welcome back to another episode of Waves and Wellness. My name's Andrew Madrazo, and I'm here to talk about a very important topic with our special guest, Parkinson's disease. Now, the cause is unknown, the cure is unknown, but there is an opportunity at a high quality of life, and that's what we're going to emphasize today with our special guest. So back to you, of course. This is Nurse Haley Joyce, and she's going to inform us about a plethora of things, but I do want to first give her the floor to introduce herself. Please, go ahead.
Thank you, Andrea.
Of course.
I have my degree in nursing from Linfield College, the Bachelor of Science in Nursing, and I've been nursing for 17 years. I've done post-surgical nursing, emergency nursing, primary care nursing, and for the last 4 years, I've been taking care of our Parkinson's patients with our neurologist in the outpatient neurology clinic here at West Palm Beach.
Wow, that's amazing. Thank you for choosing to serve with all of your experience. So before we dive deep into this, I do want to remind everyone tuning in, please, in the comment section, please drop your questions below while we have the expert here so we can address them sooner rather than later. But if it is after, we will be sure to reach out to you and follow up. Now, I want to emphasize, this is a global impact here, this disease. 90,000 individuals a year in this nation are diagnosed with it. And I know it impacts our local community as well, especially our veteran population. So what are some things that we can recommend to our community to be aware of early for symptoms?
Well, some of the earliest symptoms may occur a decade or even more before a lot of the more common symptoms that will bring you to the neurologist.
Okay.
So things like constipation, which tends to be a very vague symptom. It could be a change in your sense of smell. It could be a loss of sense of smell. One less typical symptom would be something like REM sleep behavior disorder. That's where you may have very vivid dreams, you may kick, you may scream, lash out during your dreams. So that is a little bit more atypical and might be a little bit something to look out for.
Yeah,
very distinct.
What about I've heard, it impacts your nervous system, if I'm saying that correctly. What about motion, speech, things of that nature? Are those common as well?
Yeah, in fact, the most common symptoms that bring in people to see the neurologist are what we call the motor symptoms. So that would be things like bradykinesia, which is very slow movement, or tremor, or stiffness and rigidity in the muscles. But there are also non-motor symptoms as well, Andrea. So you could have speech symptoms where you may have a very soft voice or a very monotone voice. You could have swallowing issues. You could have cognitive problems like, memory issues, attention issues, problems processing new information, multitasking, or you could have emotional issues like depression, apathy, anxiety. Those are all symptoms of Parkinson's.
Well, that's good to know. Those are many more symptoms than I've heard of. So thank you for sharing that. So as we're talking about things to look out for, it probably, well, I think it does, but please correct me, affects one gender more than the other versus male versus female. Is this correct?
Yeah, males seem to be affected more, and in fact, almost twice as many men are diagnosed with Parkinson's as women.
Wow,
it tends to affect you more as you get older, so we see more late onset Parkinson's, so after the age of 50 as opposed to early onset Parkinson's.
Okay.
And there seems to be some consensus now that there could be environmental factors which may put you at higher risk. So exposure to things like pesticides, heavy metals, and head traumas as well may increase your risk.
So those at times are out of our control, those
Right.
mentionings of head trauma, pesticides, exposures. But what's in our control is our lifestyle choices. So I've heard that eating less sugary foods and staying hydrated really helps when you're diagnosed. Is this true?
Well, we don't have a lot of great randomized controlled trials in
Okay.
terms of Parkinson's and nutrition. What we have found so far is that people who have Parkinson's and who consume a Mediterranean style diet tend to have fewer motor and non-motor symptoms, and they tend to report a higher quality of life than people who consume the typical standard American diet.
So hummus and fish, so you can get at your local
Hummus, fish,
grocery
olive
store.
oil,
Awesome.
yeah, for sure. Anything, fruits, vegetables, high fiber foods, yeah.
Awesome. What about, we're talking about motor skills. Should they not move as much or move more?
No, actually, the opposite's true.
Okay.
Exercise is a really important thing for people living with Parkinson's. And like the Mediterranean diet, the studies have found that the more exercise you do, the better your motor and non-motor symptoms will be, and the better the cognitive, symptoms will be.
So not running a 5K, right? What would be an
No,
example?
more seems to be better. So if you can exercise 7 days a week, it seems to be better and a little bit more intense to the point where you may be slightly out of breath. So you and I are talking here right now, and we're not out of breath. But if we walked really briskly up and down the hall and started talking, we would be slightly out of breath. So just being slightly out of breath seems, that intensity seems to be good.
What about maybe a certain time frame of each day? You said 7 days a week, right? So not like the whole day, so what would be the limited or max time frame you would recommend for that, for exercising?
Well, I think it's going to be different for everybody, and will depend on the person's ability and their fatigue.
Okay,
So
case by case.
Case by case.
Okay.
But if you could get in like 20 or 30 minutes per day, and it doesn't have to be all at once. It could be exercise snacks where you're just doing 5 or 10 minutes here, 5 or 10 minutes there.
Awesome. So like commercials when you're watching TV.
Exactly.
Awesome, awesome. Thank you for that. That was a good insight right there. So, we're talking a lot about the patient, but in our hospital and across the community, hospitals serve the patient, but also the loved ones. What's some advice that you could give loved ones that are, they're not diagnosed, but they are dealing with this diagnosis alongside their loved one?
Well, I think the biggest advice I would give them is to find out about the disease, educate yourself. Knowledge is power. The more you know about the disease, how it progresses, what the symptoms are, the more you'll feel in control, the more you'll be able to help your loved one navigate all the challenges that come with Parkinson's. So I think that's the biggest thing.
So you say knowledge is power and knowing all these resources. I have to ask, is there something exclusive here that we offer, resource-wise, that you wanted to
Oh, yeah,
share?
for sure. So in terms of exercise, we have a program that's designed specifically for people living with Parkinson's.
Oh,
So it's called LSBT Big. I highly recommend all our patients get involved with that. We have speech and swallow services here, so you can get an evaluation, and even if you're not currently having symptoms, it can help you in the future with techniques to use. And then, of course, our dietitians, who are amazing, can help you develop a great Mediterranean-style diet to help you with your Parkinson's.
kind of everything under one roof. That's
Yeah.
awesome. That's great to know.
Yeah.
All right, so I'm sure we have people tuning in and questions coming in, so I want to make sure that we hand it over to them.
Yeah.
Are you ready?
Yeah.
Awesome. Let's kick it off. Okay, so this is a great question. The question states, what do you recommend to patients when they're first diagnosed with the disease?
Well, I think, just to, like we said, get to know about the disease, get to know your medications, how to take them. That's something the neurologist and I will help you with. And then get to know your resources. I can tell you all about those, so can the neurologist. Like I said, we have speech and swallow, we have physical therapy, we have occupational therapy, we have our dietitians. Social workers are also a huge help. Caregiver burnout is really big, with our Parkinson's patients. And so our social workers can help you and tell you what your resources are and get you hooked up with those. So that's really important. That's what I would tell our patients when they're first.
So it definitely seems what you're saying, when you're diagnosed, you have a support team.
Yeah, you do. You
From
definitely have.
A to Z, really, it seems.
Yeah, yeah. It really does take the team working all together, to navigate this disease.
That's great to know and touch on. Thank you.
Yeah.
All right, next one. Okay, so you kind of did touch on medications. So this question is, how do medications help Parkinson's disease?
Well, so when you have Parkinson's, you don't have enough of a neurotransmitter called dopamine.
Okay.
So the biggest medication or the most commonly prescribed medication we have is carbidopa, levodopa, and that's generally prescribed by our neurologists. And that helps to increase the level of dopamine in your brain, which
okay.
helps with your motor and your non-motor symptoms. But knowing there's things that affect the absorption of that medication, and so, we can help you navigate a lot of those issues. And a lot of people with Parkinson's do have constipation and slowed gastric emptying, which can affect the absorption of their medication. So we go over that a lot with them.
So as the stages are, taking place, do you get less, more medication, or is it again case by case?
So we generally have to start giving you more medication.
Okay.
So, the neurologist may start you out with carbidopa, levodopa, but there are a couple of what we call adjunctive medications that we might add as the disease progresses. And that's just kind of on a case-by-case basis. We may alter the dosing. So you may take it initially 2 or 3 times a day. It may go up to 4, and then we have some, patients in advanced stages who take it as much as 5 times a day. So.
Okay. So it's about eating, exercising, and taking your medications to truly emphasize that quality of life.
Yeah. And the thing that I would like to just really say is that if you've gotten a diagnosis of Parkinson's, that it is a completely manageable disease. You can live with this disease, not for just a couple years, but for 10, 20, 30, even 40 years, Andrea.
Wow.
So as long as you know what your resources are and how to manage it, you can live a really, really great and productive life with it.
And I think that's the key message here that I really, truly hope that the audience is getting. It's shell-shocking, I'm sure, but with today's world, it's not the end. So
not at all.
It's so good to feel that and hear that. It looks like we have another one coming in. So is the shaking seen from the attack on the nervous system?
So I mentioned earlier that it's a disease where you lack a neurotransmitter called dopamine, and so dopamine helps with movement.
Okay.
And so if you're lacking that, you have problems with your movement, and it could be that tremor that you have. It could be that really slow movement. It could be that what we call postural instability. So oftentimes, patients with Parkinson's will have difficulty with their balance and their stability. So they fall very easily. That can be, very important with our Parkinson's patients as well.
Absolutely. That's a great question. Thank you for answering that. All right, and it looks like we have another one. How do you test for PD? I don't know if there's necessarily a test, so let's definitely touch on that.
Yeah, no, there's not a specific diagnostic test for Parkinson's. It's done by an evaluation by a neurologist or a movement disorder specialist who's a type of neurologist. After that evaluation, they look at your history and your symptoms, and that's usually how they make the diagnosis. Some people may have what we call atypical symptoms, so they don't quite fit, Parkinson's, and that may be when a neurologist would get something like a DAT scan, a dopamine active transporter scan, and that may confirm the diagnosis. The other important thing is oftentimes they'll get an MRI because they want to rule out other causes. So we want to make sure you don't have a brain tumor or something else that's causing your symptoms. But it's done by a diagnosis by a neurologist.
Okay, that's good to know. All right, so why is it, another question, why is it that veterans have a greater occurrence of Parkinson's disease?
Well, like I said, there's some theories out there so Parkinson's is what they think is a multifactorial disease. So they believe that there is a certain genetic predisposition to it. So certain genetic factors are in place. But there are also environmental triggers. And when you have that perfect combination of the genetic predisposition and the environmental factors, it often presents as Parkinson's. So if you happen to have the genetics for it, and you're exposed to something, which many of our veterans have
Absolutely.
been,
Absolutely.
head trauma, pesticides, herbicides, that may be the reason that we have a higher incidence of Parkinson's among our veteran population.
That's a great point. Great point.
So,
and we have another one. So
yeah.
back to PT, physical therapy, I should say. Can you discuss the role of physical therapy? And I'm assuming this question's talking about and helping Parkinson's disease.
Right, right. No, I think physical therapy is really essential because as the disease progresses, you may have more motor symptoms. So you may have more postural instability, balance issues. You may be more prone to falls, and so getting a good physical therapy regime in place.
Absolutely.
Where you learn, different exercises for balance, stability, and strength is also very important. So physical therapy is essential to dealing with Parkinson's.
And I have to emphasize, you said how important exercise is.
Yeah.
So definitely, I would urge, I'm not the expert here, but get that PT if you are diagnosed so that you can achieve those daily recommended exercise movements.
And get them and do them safely. That's a big
Absolutely,
thing too.
absolutely. Which our
Yeah.
PT or any other community PT, I'm sure, would ensure of.
Right, exactly.
All right. I think that about wraps it up. Yep, it sure does today. But before we close out, I want to thank you personally for talking about, a sensitive topic, but bringing some light to it. And is there anything else that you wanted to share today before we close out?
Nope, just that we're all here for you at West Palm, and we would love to help you. So if you've got Parkinson's, come see us, get to know what your resources are, and we can all do this together.
Absolutely. In it together. That's the key message here.
Yeah.
Well, until next time, thank you so much.